I know that one of the biggest problems for many people seeking help with their mental health is getting an accurate diagnosis. We don't, in most cases, have a really structured, standardized system for diagnosing and ruling out various mental health conditions. We have things called structured interviews, which is when a mental health professional asks you a series of somewhat predetermined questions that hopefully helps categorize your symptoms under the headings of various diagnoses. And we do have some psychological tests that we can do to assess the severity of certain symptoms and patterns. But all of these systems are highly subjective. They're subjective depending on you and your interpretations of the symptoms that you experience. They're also subjective on the interpretation of the mental health provider, whether that's a therapist, psychologist, psychiatrist. There's a lot of opinions and there's a lot of room for like, I think this, they think this. It's very, very difficult to definitively prove that someone does or does not have any particular mental health condition. That combined with how expensive getting support with your mental health is, in many areas, like where I live, incredibly long wait lists to see providers, and the accessibility of a lot of mental health information on the internet or on social media has led many people to go the route of self-diagnosis. And I want to make this very clear. I get it. I really, really understand. We gate kept diagnoses, basically. And we have put so many barriers in place, not necessarily intentionally, but that's the outcome of the system that we've all sort of collaboratively created. It's not a good system. It's really not. It's very frustrating to be a part of. And I completely understand why you want to just do some research for yourself, figure out what description of symptoms or diagnosis seems to best fit the experiences that you and then go with that assumption and kind of build your life and build your treatment around that assumption. Not to mention the fact that there are a lot of mental health providers out there, particularly psychologists, who only take certain insurances. And many psychologists or mental health providers in general don't even always tell you what their working diagnosis is for you, which is super frustrating. The amount of people I've seen who I'm like the second or third psychologist that they've seen, they've had psych testing before, and no one ever did a feedback session with them on the results of their previous psych testing. So they spent however many hours and however many hundreds of dollars trying to get an answer, only to not be told the answer. And sometimes when I request these records, they are garbage. The reports say nothing. They have no useful information in them. Like, even to me as a psychologist, I'm like, I don't know what this person was trying to tell you. This is nonsense. It's so frustrating. So, all that being said, I still have some pretty major concerns about the self-diagnosis trend. And I still feel like overall, at some point, you're probably going to want to have your symptoms assessed by a professional. Here's why I have concerns about self-diagnosis. The first is mental health symptoms are very contextual. Most symptoms of various mental health conditions are not automatically or inherently pathological, meaning the symptoms of something like depression or anxiety or even like borderline personality disorder or bipolar disorder might be somewhat normal and not the signs of a specific mental health condition if they only occur under certain circumstances. And I think the one that I see the most often is borderline personality disorder. I cannot even tell you how many times I have seen somebody come in with sometimes with a diagnosis of borderline personality disorder from another mental health professional, but often a self-diagnosis of borderline personality disorder because they've read up on these symptoms or they've seen TikToks or whatever of these symptoms, and it sounds so much like them. They're like, gosh, I feel almost all of those things, and I seem to feel them more intensely or more frequently than most people. So I think this probably is a thing that I have. And often on the surface, it sounds right. But so many times, like with borderline in particular, what I end up learning as I get to know this person is this is going to sound so judgmental, I know. So many of the people I have seen diagnosed either professionally or self-diagnosed with borderline personality disorder are surrounded by horrible people. And I don't love how I'm saying that, but I can't think of a better way to say it. Like everyone around them, whether it's parents, partners, bosses, coworkers, are just like treating them like crap all the time. So, of course, they're emotionally dysregulated. Of course, they're reactive. Of course, they're defensive. Of course, they're afraid of abandonment and rejection. It's because they're being treated like garbage. In some cases, they're being abused. And those emotions and those behavioral responses are actually pretty understandable reactions to the situation that they are in. But when that person self-diagnoses or is diagnosed with a mental health condition because of the way they're feeling and the way they're acting in response to the situation they are in, they then identify with this label. And that label internalizes this as this is a me problem. There is something wrong with me. And that's why I am this way. That's why I feel this way. That's why I act this way. Sometimes it's not a you problem. Okay. Sometimes it's the circumstances you're in, it's the people around you. Sometimes it's just like the world in general that's making you think this way and making you feel this way. It's not always a mental health condition. Sometimes life just sucks. And that's going to make you feel and act similar to someone who has a chronic mental illness. And just because you meet all the criteria, you check all the symptom boxes, doesn't automatically mean that you have a mental health problem because one of the diagnostic criteria for every single diagnosis in the DSM is that these symptoms are not better explained by something contextual. Another example, this one I don't see as frequently, but I have seen it. I have seen people who have textbook all the symptoms of schizophrenia. Like they look like the most obviously schizophrenic person you've ever met in your entire life. And eventually you find out that, well, they have a drug problem, or they recently had a drug problem and they are detoxing or withdrawing. Substances can create all the symptoms of schizophrenia, which is a really scary thought. And I should probably make a video on that at some point too. But I've seen so many times where, like, once this person gets and stays clean, they're totally different. And the majority of those symptoms are gone, and they very clearly do not have schizophrenia. It was substances that were causing those symptoms. Those are just two examples, but I've seen it so often. I mean, okay, here's one more. I've seen someone get diagnosed with major depressive disorder 2 weeks after their grandpa died. Like, yes, they were depressed, but they were grieving. That doesn't automatically mean that they have a chronic mental health condition. And so when you self-diagnose and you align with this diagnosis, first of all, you're pathologizing yourself and you're internalizing this label and you're saying this is a me problem, which sometimes it isn't. And then you can also find a lot of treatment information on the internet and on social media, right? So once you decide I have this, well, now you're looking for what do I do about this? And you're probably going to find a lot of things you can do on your own. You can get entire like treatment protocols on the internet for free now, which in theory is a great thing. But if you start treating yourself for a condition you do not have, in addition to you potentially seeing yourself differently, basically gaslighting yourself for normal reactions to stressful events, you're now also changing your life in a way that may not actually be helpful to you. You're going down a path in life based on a diagnosis you might not actually have. At best, it might be a huge waste of time. At worst, some of those things might be unhelpful because treatment techniques that are designed for one mental health condition might actually exacerbate another mental health condition. So you could be at risk of making things worse. Here's another problem with self-diagnosis. Many symptoms are shared across many different diagnoses. And so even if you do very clearly have some certain symptom and you associate that symptom with a specific diagnosis, it may also be associated with other potential diagnoses. The one I see this happen with most frequently is ADHD. ADHD is characterized in large part by what we call executive dysfunction. That means you have some amount of difficulty with focus, concentration, memory, organization, time management. Two things with that, actually. One is No one is perfect at those things. Everybody has some level of executive dysfunction. We are all busy people with complicated lives, and none of us, I don't care how hard you try, you are not on the ball 24/7. Like you're gonna forget stuff, you're gonna lose stuff. It is unavoidable. And so sometimes it's simply people having unrealistic expectations for themselves and thinking they're supposed to be superhuman and thinking that their normal level of dysfunction is the sign of a mental health problem. But the other is executive dysfunction specifically is also a symptom of depression. It's also a symptom of anxiety. It's also a symptom of PTSD. It's also a symptom of psychosis. So the presence of executive dysfunction in and of itself does not automatically mean that you have ADHD. Even if you check every box and you're 100% sure, like, no, it is way more for me than it is for most people. Like, it's debilitating. I can't keep a job. I can't pass classes. Okay, that probably is something, but that doesn't mean it's ADHD. And the amount of times I've seen someone referred for ADHD testing and it's come back that they have like severe depression, severe anxiety, major trauma in their past. And once we identify and treat those things, the executive dysfunction gets dramatically better, is a large proportion of people. That's really important because again, the treatment doesn't always match. If you think you have ADHD and you pursue medication options for that, for example, most ADHD medications are stimulant medications. Not all, but most. Stimulant medications increase neurological activity. If your executive dysfunction is caused by anxiety rather than ADHD, and you take a stimulant, stimulants for anxiety are gasoline on a fire. They are not necessarily helpful for anxiety. And so sometimes, and there are doctors, and I get why they do this too, because I know that we have a flawed system. I know that we psychologists are so backed up that sometimes doctors just say, forget psych testing. You are describing executive dysfunction. You tell me you think you have ADHD. I'm going to put you on an ADHD medication. I don't necessarily mind that they do that. I get why they do. But if you have not had a proper differential diagnosis and you've not also been screened, or not really screened, because a doctor will screen you, but really thoroughly assessed for like, well, how severe is your anxiety though? Because if you score like a 20 out of 21 on a GAD-7, then that's severe anxiety, and that's probably where your executive dysfunction comes from. And if we treat that with a stimulant medication, we're really not doing you any favors, probably. So it does matter. It's not just, these aren't just arbitrary labels because we need to have a word for the things that you have. They are meant to guide treatment. And the wrong treatment is not necessarily just like, oh, it didn't work. It could be like, oh, it got worse. Or, I experienced these side effects because of this thing. So, all that to be said, it's not that I don't want you to do any research on your mental health conditions. And I'm really grateful that we live in an age where people can get some basic level of information on mental health without needing to access a professional. I mean, I am doing that literally right this very second, making some of that available to you guys. So I like that in theory. And I know that we have a very, very flawed system as far as accessibility and diagnosis. I know. I probably hate it more than you do, if we're being honest, as someone who's inside that very system every day. But I would encourage you to view self-diagnoses as more of like a hypothesis than a definite answer. Even if something so thoroughly aligns with your experience that the first time you hear it, you're like, oh my gosh, this is the answer. This is me. This is the thing that I have. Follow up on that theory. Like, start with that. Yes, that's important. I'm not saying ignore it, but take that information to somebody who can help you look into it a bit more thoroughly because this stuff is more complicated than it might seem on the surface. It's so complicated, we haven't totally figured out how to do it yet. We have a very flawed, very imperfect system. I also know that finding someone who you trust and who you feel like really listens to you, that's not a given. Like, I'm saying get your self-diagnostic information, treat it as a theory, take it to someone who can help you look at it. But I also know that the first person you take it to might be a D-bag who doesn't listen to you. And I'm sorry that that happens, but I know that it does. Don't be afraid to seek a second opinion, a third opinion, something you should do after any kind of psych testing, even if it's just a diagnostic interview with no inventories or tools. Ask the person, what their working diagnosis for you is or diagnoses and ask them why. And one of three things is going to happen. They're either not going to want to tell you, instant red flag for me most of the time. Like you should be able to articulate your rationale for why I have this thing. If you see a doctor because your arm hurts and they tell you you've broken your arm, it's reasonable to be like, can I see the x-ray? Like they should be able to support their diagnosis, right? Our tools are less precise. We should at least have some rationale for why we think what we think. If we don't, or if we're for some reason being super secretive about it, like, oh, I can't tell you that, that's weird. And that's a red flag. Second possibility, they explain something to you, but it doesn't sound right. It doesn't match, right? Like they say, I think you have bipolar disorder because these periods of time you experience sound like manic episodes. And when they're explaining what a manic episode is and you're listening, you're like, I just don't know that that's what I experience. That's not a red flag, but it might just mean that they don't understand you. It might mean they didn't really grasp what you were telling them. Or a third possibility is they speak right into your soul and they tell you everything that's happening to you, and you're like, wow, that you just nailed it. That's me. You got it. That's a really good sign. And that's probably a sign that this person understands you and has hopefully diagnosed you correctly. And that you can then, with some level of confidence, as much as we ever get in the world of mental health, which is not a world of definitive answers, with some level of confidence, you can then hopefully pursue treatment for that diagnosis. So that's my summary of why I'm semi but not completely against self-diagnosis and mental health. I hope it's helpful information to you, and I hope this gives you something you can use. Take care, and I'll see you next time.